Isometric ramping is a great tool that we can use pretty much anywhere in our body when it comes to helping relieve or cope with localized muscle spasm. Now, even though this video is going to go over application for the backside of the shin or calf, know that you can apply these concepts pretty much wherever we may be, at the low back, side of the hip, even bottom of the foot, or even between shoulder blades. So to start, we'll take a lacrosse ball, tennis ball, or something similar and place it directly where we feel a lot of that tightness or tenderness when we're touching the muscle. From here, I typically encourage you to try to breathe through the pressure, going in and out through your nose, or even making tiny wiggles back and forth to try to sustain the pressure for about 1 to 2 minutes. If being directly underneath the tenderness is too much to tolerate, move it up, move it down, move it to the side, and move, or just simply pick an area that you think you can handle for that longer duration time. Now, after 1 to 2 minutes, if we can get that far and tolerate it, the idea here is we're going to make a muscle directly where we feel the ball. So we've spent a minute or two letting the ball sink into the tissue to try to promote relaxation. And now we're going to ramp up the muscle into a local contraction. To do that, I'm going to picture where I feel the ball. I'll focus my body, bringing a little bit of tension throughout. And then I'll simply try to push the ball out from where I feel it pressing. And I'll hold here for about 5 to 10 seconds. And then slowly relax off the contraction, again sinking back down into the ball. Once I feel ready, I'll gather my attention again, find exactly where the ball is pressing, try to squeeze or make a muscle to push the ball out of that space, and hold for 5 to 10 seconds. Slowly releasing the contraction will probably require some degree of practice, but that ultimately is how we would perform isometric ramping.